The third most commonly diagnosed cancer and the second leading cause of cancer death in both men and women is colon cancer. The American Cancer Society estimates 136,830 people will be diagnosed in 2014 and 50,310 will die from colon cancer in the United States. Today I want to inform you about how colon cancer can be prevented and just how dangerous this disease can be. I plan to go in depth about what colon cancer is, how to prevent it, the symptoms, and how it can be treated. I know that everyone in here has been affected by cancer in some way or another, myself included. When I was 2 years old, my mother was diagnosed with colon cancer. This was something that little did I know would have an impact on my life forever. My mom has currently been in remission for 17 years. Within the past few years, I have made it a goal to bring awareness to colon cancer and show everyone why this disease deserves just as much attention as breast cancer, lung cancer, or any other disease. With that being said, I have done some research to present to you today just exactly how big of an impact colon cancer can have on your life if it is not treated properly. Colon cancer is defined as cancer of the colon or rectum. First, let's take a look at what exactly colon cancer is and what causes this disease. Most colon cancers develop first as colorectal polyps. These are abnormal growths that grow inside the colon or rectum that can become cancerous. Only certain types of polyps can become cancer. These are known as adenomas. Taking out a polyp early when it is benign may keep it from becoming cancerous. Now that we've established what colon cancer is and the cause behind the disease, we can go a little further in depth in examining the symptoms. When it comes to the diagnosis of colon cancer, there are some common warning signs to look for. Many people with colon cancer experience no symptoms in the early stages of the disease. However, the most common symptom one can experience upon the diagnosis is rectal bleeding or blood in the stool. Though let it be known, there are certain situations in which the bleeding may be hidden. Changes in bowel habits, persistent abdominal discomfort, and bowel obstruction are other common symptoms of this disease. Now that we have discussed what colon cancer is, what causes the disease, and the signs and symptoms, it's time to discuss how to prevent this disease and the treatment options. Believe it or not, colon cancer is one of the most preventable cancers. The most effective way to prevent colorectal cancer is through early detection and the removal of benign colorectal polyps before they become malignant. Routine screening is the number one way to reduce the chance of getting colon cancer. Beginning at age 50, it is recommended that people at average risk get screened at regular intervals by having a colonoscopy performed. A colonoscopy is a test that uses a colonoscope to examine the inside of the entire colon and rectum. The colonoscope is a flexible lighted tube that has a camera attached to the end. The tube is inserted into the rectum and the doctor can use the camera to take pictures of the inside of the colon. Taking medications to treat a precancerous condition or to keep cancer from starting is another prevention method. Familial polyposis is an inherited disorder characterized by the early onset of hundreds to thousands of polyps throughout the colon. People with a first-degree relative who has colon cancer are between 2 and 3 times the risk of developing the cancer than those without a family history. It is necessary to begin having routine colonoscopies before the age 50 if familial polyposis is present. Now that you know how this disease can be found, let's talk about treatment options. Treatment options do vary depending on the stage of the diagnosis. Most cases of colon cancer are not found in the early stages. This is attributed largely to the fact of how quickly this disease can spread or metastasize. There are 4 stages of this disease, with stage 1 being the least metastasized and stage 4 being the worst. 40% of colon cancers are found while the cancer is at a local stage, 36% are found at a regional stage, and 20% are found after the disease has spread to distant organs in stage 4. The sooner the cancer is found, the easier it is to treat. When the cancer has progressed to stage 4, there is only so much that can be done to treat the disease. Chemotherapy and radiation therapy are common treatment options for colon cancer. Chemotherapy is a drug treatment that uses powerful chemicals to kill the fast-growing cancer cells within the body. This drug is also used to prevent the cancer from reoccurring. Radiation therapy is the use of radiation to control or kill malignant cells. Surgery will be recommended for the advanced stages of colon cancer. Part of or all of the colon may need to be removed depending on the severity of the diagnosis. However, The earlier this disease is diagnosed, the fewer treatments you will have to undergo. This is why routine screenings are so important. Today we learned that colon cancer can be one of the most dangerous forms of cancer, but also one of the easiest to treat if caught early. In conclusion, I hope I have broadened your knowledge on colon cancer. You now know what colon cancer is, how to prevent it, the symptoms of the disease, and also how it is treated. When my mother was diagnosed, she had stage 4 cancer. She had to have surgery to remove all of her colon and undergo chemotherapy and radiation treatments over the months following the surgery. According to the Colon Cancer Alliance, there are currently more than 1 million colon cancer survivors alive in the U.S., and I'm proud to say that my mother is one of them.